Hi, everyone. I'm Andy Schwartz. I'm a registered dietitian. I am a happy family expert with Happy Family Organics and a certified lactation counselor and a mom of two kids myself. And I'm really happy to be here today. I think this is like my third Prego Expo, actually, to talk about starting solids. And I know this is like a hot topic that, a lot of us parents or parents to be are really, really worried about and really want to get it right. And, I'm always here to share the nutrition facts as a dietitian, as a mom, and of course, as, kind of a friend that really it's not about getting it perfect or getting it, kind of right, so to speak, but it's really just about kind of knowing the basics and then kind of having some guidelines to follow along the way. Because I know there's a lot of misinformation out there on like, well, can I start at 4 months or do I have to start with cereal and, all those kind of things that maybe your grandparents or parents or, different people along the way may share in a way that's trying to help you, but then can actually cause more confusion. So my goal today is to kind of debunk some of the confusion, to again, provide you with the facts and really give you the tools on how to raise an adventurous eater. So it's really more than just starting solids. It's about raising an adventurous eater that hopefully will have less picky eating in the future. And that's what we're going to do today. So after the presentation, I do invite you to join us in the Happy Family Organics Expo booth, where I'll be answering any questions that come up. Of course, you can put them in the chat too, but as well, we can do it live there. So yeah, let's, as they say, let's dive in. So we're going to talk a lot about the guidelines to begin with. So kind of these are like the 4 areas. The guidelines on when to start, the stages of readiness, which kind of ties in, of course, when we're starting, the specific recommendations of when and what to start as far as solids go, and then some of the behavioral aspects that I like to talk about to help prevent and to help maybe reduce some of the picky eating behaviors that might be developing as they turn into toddlers, or sometimes even when you're starting solids, there might be some of that behavioral aspects that would be helpful now. So let's go into that. So really the whole first year, and this is again where a lot of parents are, are concerned about kind of where to go, where to start, or how much is really needed, I guess I would say. So really the whole first year, look at it as breast milk and formula are really the gold standard of what their nutrition is going to be. So that doesn't mean that they're not getting a lot of nutrition from different solid foods, especially like 9 months to 12 months, but certainly like from the 6 to 9 months period, we're really looking at it more for just having them get used to eating a solid, of course, versus just like a liquid. So but try to have that reassurance that nutrition does not have to be perfect with the solid foods, and that it's really just more of that introduction, giving them that experience and kind of just finding and feeling your way through it with them, because every kid's different. Some kids, most we want to have them starting at 6 months, but some, if the pediatrician recommends having them start a little earlier, they could start earlier. Some kids might start a little after 6 months, just based on their preferences. And even with all that too, there's a lot of differences as well with just while they're eating solids on what foods they may like and what foods they don't. So just hang in there. We'll get to all the nitty gritties on this, but basically just know that really that first year, it's that we want to have them just really still get their breast milk or their formula as their main nutrition, while having these new flavors, these new smells, these new touches, and all the things that come along with solid feeding that we sort of take for granted, that is brand new to them. So that's a lot for them to take in. So just kind of having more of like a relaxed attitude, but also like a very, kind of adventurous attitude yourself, to like give the child and the children that sort of exposure. So that's really important, I think. And then the consistency, we want to have them consistently exposed to these different variety of foods to help increase their palate, to increase their diversity of their palate, so that as they're having more solid foods as like 8 months, 9 months, and a year and beyond, they don't have that sort of picky eating of just eating certain foods. So the diversity, the consistency of that, and then of course the variety of all that really helps in that goal of creating an adventurous eater. So yeah, I want to make sure I have time for everything. So we're going to go right in now to the stages of readiness, which ties into like exactly like the when. So if your baby can push, if you're putting food, let's say you're given the go from your pediatrician, maybe 5 months, a little earlier than usually the recommended 6 months, from the Academy of Pediatrics. If your child is like pushing the food out with their tongue, consistently doing that, once or twice is probably not a big deal. But if they're consistently kind of pushing the food out, as you're, spooning the food, that's another sign that maybe they're not ready to, they don't have that, the tongue reflex is what it's called. If they're still doing that tongue reflex, chances are they're really not ready yet. So making sure that they can take the food in the mouth without using or having that tongue reflex. Of course, sitting up with support is very important. If the baby's not able to support their torso, and of course, neck and head, probably not able to digest safely the food. So making sure that those two things, I always say them at the top, are definitely there before you start. Even if, again, other people tell you, oh, give it a try, or they're X amount of months old, they should be trying it now. Again, they need to have those different stages of readiness to make sure that it's safe for them and that, they're going to be able to actually take down the food. One that often people think is like the big stage, which I would agree with, is about them like having the interest. Like, so let's say they're at the table with the family or they're just around food and they're like really looking and kind of maybe even making sort of mouth gestures, if you will, or kind of mouth interest. That's another good sign, but they still need to have those top two when you try them to be able to continue offering them. And then that they open their mouth, of course, before or as you're trying to spoon the food. If they're closing the mouth, we don't want to open the mouth for the child to make them take the food. So making sure that, of course, they're opening the mouth independently, that tongue reflex is not pushing the food out, and that they're sitting strong and upright and able to digest the food. And then the last one I'll say, which sometimes people don't follow as closely, but the baby has doubled their birth weight at this point of when the complementary foods are going to be started. So those are the 7 things. They're no longer having the tongue reflex, sitting up without really support. I mean, of course, a baby seat is important, but that even with the baby seat, they're able to independently sit up, that they are, interested in food. One thing I did forget to mention, that they don't turn, their heads staying in the direction of food. If they're like turning their head or they're kind of all over the place with the head, that's another sign maybe they're not interested. So just kind of using your intuition, but also just, watching these seven signs, and then ending, of course, with the doubling the birth weight. But most of the research is recommending 6 months still. The American Academy of Pediatrics does recommend 6 months, and that just helps with the maturing of the digestive system. It helps reduce potential asthma, allergies, any risk of choking. So even though you may be really eager to start at 4 months and they might meet all those signs, best to sort of wait a little closer or at 6 months, and then also, observing all those different observing characteristics that I just mentioned with those top 7. Okay, so wanted to get a little bit into some of the nutrients as well. As dietitians and lactation counselors, we talk a lot about vitamin D. So vitamin D is an important mineral, important vitamin rather, which is leading to the mineralization of bone development. So with a lot of breastfed babies, they're supplemented with the vitamin D, about 400 IUs, like pretty much from the day they're born. With formula-fed infants, depending on if it's like a supplementation or like a full formula-fed, they may not need that additional vitamin D. So depending on how the solid foods are going, at 6 months or close to 6 months, the vitamin D supplementation could be done through food. So that's why I wanted to bring that up before we sort of go into the textures and all that, because it is sort of this transition from the way you're currently feeding your infant, either formula or breast milk, on how much you would want to continue to supplement the 400, and then how much of the solid foods actually have the vitamin D. So the vitamin D is going to be found mostly in your meat products. So they're going to be in fish, all your meats. They're going to be in eggs. They can be in vitamin D fortified juices or cereals. Of course, yogurt, dairy products will have vitamin D. Although we do not recommend giving cow's milk until 12 months, after 12 months of age. So when I mention like the dairy products, I'm talking more about the yogurt, cottage cheese, those types of things, and cheese, but not actually cow's milk. And the reason why we don't recommend that is it actually can, according to the CDC, increase the risk of intestinal bleeding. And too many of those kind of harder proteins of like whey and casein that are in the cow's milk, I guess, leads to from the research to that intestinal issue with also some kidney overload. So it is a pretty serious thing to not give the cow's milk as like a formula or breast milk substitute. At 6 months, that's something certainly to wait after 12 months. And, maybe that's a personal choice as well, if cow's milk will be something that you offer. But it's definitely not something that you want to incorporate until that 12 months. Of course, the yogurt and cheese, as I mentioned, would be totally fine. But of course, balancing that out. You don't want to just give all these vitamin D foods, but these other foods that I'm going to talk about very shortly, like the vegetables, the fruits, different whole grains. But the vitamin D is something to sort of keep your eye on, regarding like a key nutrient, a key vitamin, as you're transitioning from, less fluids to more solids. So let's go into now the what. We talked a lot about like what maybe you've heard from your grandparents, your sisters, your friends, and like, when I was feeding my two children, I have a 8-year-old and 6-year-old now, but it really wasn't that long ago that I was kind of navigating this whole area of solids myself. And even as a dietitian, you hear so many different recommendations. Now, we do, as dietitians, follow the Academy of Nutrition and Dietetics. We follow the CDC. We follow the American Academy of Pediatrics. So these are all very evidence, research-based recommendations. So I would advise to follow those recommendations over what you may have heard from other parents, or maybe even what you did for your first child or first couple of children. I know feeding, of course, is a very personal decision, but just want to kind of guide you towards that evidence-based feeding. So the evidence doesn't currently show that we need to actually start with cereal, that is, anymore. So it can be something that you just feel more comfortable with. And interestingly, I started my firstborn with the cereal, with like, the rice cereals, and that was fine. But we quickly went into vegetables because, again, that developing a healthy palate and wanting to have that exposure early on to help lay the groundwork for their acceptance of vegetables in their toddler years, and of course beyond, is very important. And rice cereal is kind of very, very bland, very plain type of food, but it's really more that the texture is kind of comfortable for a lot of parents. I mean, when those first solid foods are introduced, we want to have them be thin. It's almost, when you think about the formula in the breast milk, I mean, that's a very thin, it's a liquid, of course, but it's still a very thin texture. So as we go into those first foods, the rice cereal kind of works for a lot of people because it is that very thin texture. So you can do, though, the same thing with vegetables and even fruits. You can actually just puree them either yourself, or of course, there's many products in the market that have those first foods already pureed for you. And that's something you can certainly do. But don't necessarily worry about the food group or what food it is. You could just do what your comfort level is. But I think there's a lot of value in those vitamin D rich foods I mentioned, like the eggs, the soft fish, the different meats that you can thinly puree as well, because they're getting that vitamin D, which they need. Plus, they're getting that extra protein along with these vegetables that would shortly come, next. And sometimes some parents will even do a combination of, a little bit of the meat and then a side of the vegetable. So you can pair things together. Typically, though, we do recommend going 2 days, like 2 or 3 days between foods, just to kind of make sure that there's no reaction, or that there's nothing, specifically with that food that would be harmful to your infant. But shortly thereafter, absolutely, you can balance, their plate, so to speak, with having that protein or pureed meat with one of the pureed vegetables. And really, there's so many options out there. I did a lot of butternut squashes early on because it does have like a sweeter taste, and sometimes like the more kind of harder vegetables could be a little more challenging for babies at first, but like peas, pureed peas, of course, the different squashes, those tend to be a little sweeter, and breast milk and formula is also sweet. So that's typically a good transition, particularly if your baby is not as accepting of maybe the vegetables at first. Maybe go with more of those like sweeter type vegetables. Or of course, you could also go with the fruits. As long as they're pureed and there's no seeds or chunks in the beginning there, that would be perfectly safe and a good option as well. But that bitter taste of vegetables sometimes can be the challenge of them accepting them. So kind of just be creative on maybe how you either blend over time the foods, those bitter foods, or just having a different side of something maybe a little sweeter to kind of wash it down in a sense and making that vegetable more accepted. So I did want to say though, we don't recommend adding any sugar or salt to the foods. So sometimes parents will say, well, I know I like my vegetables better when I add some salt to it. So can I add salt to my baby's food? And we really don't want to do that. It's one of those things where they have such a clean plate. I mean, the clean palate, clean plate. Like we don't want to start off adding that like extra flavor, so to speak, that really does not benefit their health or their future acceptance of foods without that. So really no added sugar or salt. So the sugar, I would say, also applies to the yogurts that I mentioned as well. We don't want to do the sweetened vanilla type yogurts, but really the plain unsweetened type yogurts, which again, I know as adults will say, well, I don't really like those kinds. I don't like those unsweetened flavors as much, which is understandable. But again, it's because we're used to having more of the sugar in our diet. So trying to go more unsweetened as much as possible would be really important. I do see a few questions about allergies. So I will try to touch on that if I have time at the end. I do think that's important too, but it's kind of a whole nother topic in a way, but I will talk about that in a minute. But as far as like the yogurt, yeah, just the unsweetened would be what I'd recommend. There's so many, and whole milk, I should say too, because there are a lot of low fat options, which a lot of us adults choose, but we want to go more for the whole fat dairy yogurts because of the extra fat. And because of their development, they need actually more dense calories because they're eating lower volume. So the whole fat will have more dense caloric intake as well as the extra fat for their brain development. So the whole fat's important at their age. So going back to the what, really the what is kind of whatever food you feel comfortable starting, as long as it's the right texture. I do recommend having the meats a little early on or the eggs, but then very shortly after or around the same time having the vegetables introduced. I also want to talk about how much of those, because a lot of times parents will say like, gosh, my child's not really eating that much. And again, as I kind of started with, they don't need to eat a lot. I mean, they're still so young. They're not moving hardly at all at that age. Maybe they're crawling, and you might think differently, like, gosh, they're crawling all over the place, but their physical needs are not that high. So we do want to nourish them, of course, but it's not anywhere near the amount of food a lot of parents think. So really, this is how much they need. They need 1 to maybe let's say 1 to 2. We'll say 1 to 2 tablespoons of the food 1 to 3 times a day. So when you think about a tablespoon, I mean, getting your baking measurements out, I mean, it's a really small amount. So think more small, but think more strategically. So, we have, again, these different like vitamin D rich foods, protein rich foods, the fiber and the beneficial vegetables. Like think of more those types of ideas versus how much they're actually eating. Even if like you put a couple tablespoons out and they only eat, a couple spoonfuls, that's great. That's really great because they're getting that exposure. So yeah, trying to think or focus less on the amount as far as how much they're eating and more the what, but then offering it a lot. So yeah, 1 to 3 times a day in the beginning, obviously adding up to maybe 4 times a day as they're eating more. But it doesn't have to be this like once they're 6 months, like dive in and have them eat a whole plate of food or a whole entire jar or pouch. Does not have to be that much. You can save those pouches, you can save those jars usually for, the day and reuse throughout that day. But, after 24 hours or so, we do need to discard it. So same thing, just make smaller amounts, maybe pour, if you're making your own baby food, pour. I used to put them in these little like Pyrex glass containers, and that would freeze them and then thaw them out. So, you can make more amounts, but they don't need to eat those larger amounts at that sitting. So let's go into now the variety. Oh, I forgot to mention something. Because you are doing the breastfeeding and formula while you're doing the solids, you want to wait about 60 minutes after a breastfeeding, nursing session or bottle session, formula fed bottle session, to offer the food. Because think about it, their stomachs are still pretty small. So if you're giving them like, 4 or 5, whatever ounces in a bottle or more, perhaps, depending on the size of your baby, and then, or you're nursing and, again, their nursing efficiency is really good at that point. Like, they may not be hungry for solids. And then you're wondering, why aren't they eating solids? Well, it's probably because they're not hungry. So the timing is helpful. And, obviously this can be hard to plan if you're having a caregiver take care of your baby or they're at daycare. But best you can, trying to have that like at least 30 minutes up to 60 minutes of once they finish their bottle to then eat. Some parents will even do the solids first, and if they're struggling with the kids getting the solids, and then doing the bottle after. But timing it out is good and helpful so that we're not overloading the stomach and overloading the amount of volume in their stomachs. Okay, so now let's go into like how you can prepare some of these foods. So, you can do sauteed, you can do steamed. I mean, when you're doing the early pureed, usually it's going to be steamed. But as the textures advance, which I'll talk about soon, you can do different methods of cooking them. So it doesn't have to always be steamed. You can roast, cooking them in the oven on a cookie sheet. You can do even raw. I mean, obviously, like the cheese and stuff would be raw. I mean, pasteurized, of course, but you can definitely do like raw, very thinly chopped as they're advancing. So just kind of thinking beyond how you can offer these solid foods to your child and trying to have them be as minimally processed as possible. It's very convenient to do different packaged foods, and they totally have their place 100%. But it's also very helpful, especially with more of the vegetables and, of course, the dairy foods like the yogurts. I mean, they're packaged in theory, but they're really minimally processed. And the cheese, again, very minimally processed. So you can do is kind of a concept of minimally processed within the convenience pouches or different types of, kind of like teether foods, if you will, like those little kind of cookie crackers. Trying to like have them in a very limited, maybe one time a day kind of thing, and giving them more of those solid whole foods at the right texture. So now let's talk about the textures. So we already mentioned about the thins, right? Thins or purees are stage 1, kind of our first initial offerings. And they can be, I mentioned all the meats, I mentioned the eggs, I mentioned the cereal, the rice cereal. Oatmeal is also great here. I used to get oatmeal and actually grind it down. So like, the typical rolled oats are a little thicker. You can get regular rolled oats and then in a grinder or food processor, just grind them down to a thinner texture. There's also a number of products out there for babies with oatmeal too. I know we offer some. So there's all kinds of, all kinds of different ways to add grains, the whole grains as well. And oatmeal is really a great one. I actually recommend that even more so over the cereals, the rice cereals, but all can fit. Then after you do that, and so that again could be maybe, depending on your baby, like a month or 2, you can start doing like a lumpier mash. And the lumpier mash can be tricky because parents will often worry like, well, how lumpy can I make it? And just think of it more like as like, little less than 1-inch cubes. And they could be like, maybe a little bit bigger pieces of cheese. They can be cooked whole grains like the quinoa, or even different pastas if they're like a softer cooked, like a macaroni, but again, cut, not a big macaroni, but a kind of smaller cut macaroni. And of course, the quinoa is great. So thinking like about it being still thin, but it's now kind of like a lumpy texture. Mashed potatoes would be great. Again, macaroni, those kind of things, but definitely not like a spaghetti or a rigatoni, nothing that size, but a kind of a lumpy, thinner mash. Then we go to the finely chopped. And that's where, again, like different types of pastas, different whole grain pastas could work here more. And all different foods that I mentioned already, like the vegetables now can be more finely chopped. Maybe there's even some raw in. Timeline on this one's probably more like 9 to 12 months or even 10 months. Really depends on how your child's doing. Some kids, again, are accepting the solid foods very easily, and then some are not. So never wanting to advance before they're ready, but at the same time, not holding them back either. So it's a real dance, and it's knowing your child and observing your child. Obviously, if you're noticing that they're struggling getting, the previous texture down, not advancing yet. So, just really being in tune of what you're offering and not rushing the process, because listen, they're going to have the rest of their life to eat solid foods. They don't have to have it all done in the first, 3 to 6 months. So, yeah, and thanks for sharing. I see some of you guys are saying that you guys like the oatmeal. And, I see there's a question about baby-led weaning, and thank you, Eleanor, for giving a nice little link on that, because that's a whole nother kind of talk as well. And I'm trying to stay really concise on the starting solids, because that, although you could definitely say that's applicable there, it's too much content to add in today with that. But I think I have time, for the, maybe not. I was going to say, I think I might have time for the allergens, but if not, come out over to the expo and we can talk a little about the allergies there. But I do think I may be out of time, right? Because I started at 1. Okay. I don't know. They're not kicking me out yet. So someone just asked about the veggie though. Since I think I am pretty much done with the time that I'm looking at here. I had shared that really any vegetable that you can thinly puree works great. What I found with my 2 kids that worked really well is the butternut squashes. Those they really liked for the vegetables. I mean, there's the peas, you can, mash peas. Most of what I did actually was in like a food processor. So I would take I would steam the different foods like the butternut squash or the peas, or I'm trying to think some other vegetables that my first kid liked. But I would just kind of things that I was eating. Honestly, I would try to use a lot of what we were eating, and then I would steam it, put it in the food processor, maybe add a little breast milk to it or water, and there you go. Super easy. But I think, it's got to be time, I think, to go over to the booth. So I guess what I will do is I will exit and go to the booth. So if you have more questions, and again, I hope to touch on the allergens over there too, come on over. Yeah, we are done. Thanks so much and good luck. This is so much fun. And I really enjoyed chatting with you guys, and I will look for you at the Happy Family Organics Expo booth. Bye.